Breast lift or breast implants? This is a question that I get quite a lot, and it can sometimes be tricky to answer. Sometimes it's easy. Sometimes there are individuals who it's clear need a breast lift in order to improve the shape of their breasts, and whether or not they have implants is optional. But the breast lift is necessary, and there are other patients who really don't need a breast lift at all and will get a great result with implants alone. But it's the borderline cases, like anything, it's the borderline cases that are the tricky ones. And one thing that I always ask patients is it the shape that you don't like, or is it the volume that you don't like of your breasts? In that, whatever bra cup size you wear now, are you happy wearing that cup size, or would you like to be a bigger cup size? If you're happy wearing the cup size that you wear now, then it may just be a lift that you need in order to improve the shape of your breasts and to rearrange the volume that you have there, and to make the breasts sit higher on your chest and to give you a better shape. And that's where a mastopexy really comes into its own. A mastopexy is the best way to improve the shape of the breasts, and broadly speaking it keeps the volume around about the same. A small bit of skin is removed, so there might be a little bit of volume that's taken away, but broadly speaking you'll be around about the same cup size as you are now. Now, if you wear a certain cup size and want to be a bigger cup size, then the best way to enhance the cup size is with implants, and implants will make the breast bigger. Now, if you do have a bit of a droop to your breasts and you've lost the shape of your breasts, then implants can go some way to take up the slack, if you like. But the one thing you have to be aware of is you need quite a big implant in order to take up the spare skin, and it's never quite as good as doing a breast lift. And so there's a compromise to be had here, and so it's something you really need to go through carefully. And a big implant can take up that slack skin and can add volume to your breast and can give good results, as long as you're aware that it will not significantly lift your nipple. You really need a lift to do that, and if you just want a modest increase in size or no increase in size at all, then I would suggest that maybe you just have a lift in order to focus purely on the shape of the breast and not have implants. Now, a lift does carry with it increased complications, not least of which the scarring involved. So it is really something that you need to look at the cases of the surgeon in question, and look at what can be achieved with different breast shapes to take advice on it. So I hope that's been helpful. Really, in the borderline cases, really you need an expert opinion. Look for a plastic surgeon. Look for FRCS Plast after the name. And if you feel that you're not getting a good advice, or you're getting conflicting advice, then go and see a few. There's no black or white in plastic surgery. You'll often get different opinions. It doesn't mean one person's wrong, but it's good to get several opinions, and hopefully you'll start to see some common themes and get to a position where you can find out what's right for you. So all the best and good luck with that.